All right. Hello, everybody. We are here at the Children's Hospital of San Antonio, and we are so excited that the COVID vaccine is now available to children ages 12 to 15. And we wanted to start a conversation. We have been engaging with moms and caregivers on social media, and there are a lot of questions that everyone has, and we thought it'd be really great to take some of those questions and field them with two of our experts, Dr. Rebecca Houston and Dr. Elena Mikalsen. So I will let them introduce themselves.
Great, thank you. My name is Dr. Rebecca Houston, and I am the Section Chief for General Pediatrics with Baylor College of Medicine at the Children's Hospital of San Antonio. And the medical director of the pediatric primary care clinic at the Children's Hospital of San Antonio. And so we see plenty of children for their primary care.
Hi, and I'm Dr. Elena Mikalsen. I'm the Section Chief of Pediatric Psychology at the Children's Hospital of San Antonio, and I'm an assistant professor for Baylor College of Medicine.
Thank you very much, ladies. Dr. Houston, why don't we start by talking about kind of what the guidance from the FDA and the CDC means for being able to vaccinate this group of kiddos that represents about 20% of the population.
Great. So the vaccine that we're talking about is the Pfizer vaccine, and the FDA gave emergency authorization for that vaccine back in December. So the Children's Hospital of San Antonio has been giving the Pfizer vaccine to many, many thousands of people here in San Antonio since December. Then there was authorization first, and that vaccine at that time was down to 16. So in our clinic, we have a COVID vaccine team that has been giving vaccines to our patients ages 16, 17, 18 for several months now. And so we've seen how well this vaccine has done in this group. And now just this week, the Advisory Committee on Immunization Practices at the CDC has approved the use of this Pfizer vaccine down to age 12. And so now we're super excited that we're going to be able to offer that vaccine to now children ages 12 and above and provide that really critical protection against COVID.
So important. And I think in addition to making it available, I think probably there's a lot of kiddos out there who have dealt with a lot of stress and anxiety and kind of fear, probably parents too, about what it means to be able to get this vaccine into the arms of their kiddos. Dr. Mikalsen, like, what are you seeing in your clinics? What are you hearing from kids and from their parents?
Well, actually this week and last week, I was seeing a lot of that age group, and kids are super, super excited. Just everybody. I saw 3 kids today that they said they're heading straight after my appointment. They're going to the Alamo Dome because it's walk-in now for vaccinations, and everybody's just thrilled. That age group in particular has been very vulnerable to anxiety and depression from being indoors, from being away from school, from being isolated. And they're really, really looking forward to having more freedom, to seeing their friends again, to having sleepovers again. Many of them are going to do summer school, and summer school starts in a couple of weeks. And so they're really hoping that they can get that Pfizer vaccine, both shots in before summer school starts, because they're 3 weeks apart. So it gives them just enough time to kind of get that going. A lot of families are telling me they're really, really looking forward to taking a summer vacation, because last summer nobody was able to go places. And so they're really excited that, you know, the whole family's been vaccinated, and they've just been waiting for their younger kids to get the vaccine. So people are just go, go, go.
Yeah, go, go, go is right. And to be able to do it safely is even better. Dr. Houston, what kinds of things would you tell a parent who says, you know, I'm worried that this vaccine is not safe for my child? It was emergency approved for us as adults, and maybe it's okay for me to get it, but it's my child. This is the most important human being in my life. What would you say to those parents with those kinds of fears?
So it's understandable that a parent is very careful about consenting to vaccines for their children. And pediatricians are also really careful about which vaccines they think are appropriate for children and a sense that they're safe. So this is a new vaccine, but the technology they've been working on the technology for these RNA vaccines for decades. So this is not a new technology at all. And we have a track record now with millions upon millions of doses for the age group that we just approved from 12 to 15. It was very well tolerated. In their study, it was 100% effective. And the side effect profile is very similar to what everyone else has experienced. It's a good vaccine. There's sometimes some minor side effects, but it's very well tolerated. In our clinic, our COVID vaccine team has given hundreds of doses to the teenagers, and they've all done extremely well. So I have every reason to think this is going to be a wild success. I have no reservations at all. And I think it's going to be really, really well tolerated. And this age group appears to have a very good immune response to the vaccine.
I also think it's interesting looking at flu cases this year. You know, usually flu seasons can be really out of control, heavy, high cases of flu. But because we had so many precautions in place with masking and washing hands and being socially distant, we really didn't see a whole lot of cases of the flu. Is that?
It has been an interesting year for sure. And I do think this isolation and masking has helped. But it's very, very clear that children, in addition to as Dr. Mikalsen has pointed out, the many psychological effects, this has been really difficult on children physically. So we know there have been 13,000 hospitalizations of children in the last year from COVID in this country. And here in Texas, we've had over 50 deaths of children in the last year. So this is in no way a benign childhood illness. And we finally are now offering some really good protection, which I'm so happy to be able to offer to our families.
We are too. And I think just the idea of helping our kiddos get one step closer to being normal kiddos, and the importance of them being in an environment where they're in a school, where they're around their friends and teachers. And, you know, that's Dr. Mikalsen will say that's such an important part of just kids being kids, is that they need to be around other children.
Yeah, absolutely. Kids have been so isolated and so scared to see their friends. And some kids, you know, have siblings who are really vulnerable. So even if, you know, they went places, they were still really afraid to expose themselves to the virus, because what if they bring it home? And some of the kids have had siblings who are all vaccinated. And so they've just been really looking forward to finally getting that last bit of protection.
So true. What about questions from our moms on social media, Meg? What do you have over there?
Questions we have is they just said that I'm going to wait and see how the other kids do with this vaccine before I get my child vaccinated. What would you say to that family?
So I think some degree of cautious with new medical technologies is always reasonable. But really, we've had experience now with millions of doses of this vaccine, and there's not any reason to think that a 12-year-old is going to respond differently than a 16-year-old. So it really is, this vaccine has a good track record, and I don't see any need to wait at this point.
Thank you. The next question is about masks. It says, how do you deal with the big feelings around getting your vaccination and still having to wear a mask? Dr. Mikalsen, I think this one we get for you.
Okay, well, we wear masks to protect others, sometimes more than to protect ourselves. And so there will still be younger siblings to protect. There will still be other children who are not vaccinated. So as per CDC guidelines, we will still wear masks when we're in indoor spaces until we reach that herd immunity and until we're kind of in the clear. But kids do not mind wearing masks. It's actually quite incredible. They're better at wearing masks than we are. I have kids coming in who are so diligent about wearing masks, and they bring extra masks, and they have a collection of masks, and they bring their teddy bears in masks and dolls in masks. Kids accept the reality that we give them. And this has been their reality for 14 months. So they don't mind wearing masks. They actually say, you know, I've heard kids say, well, even after they tell me I can take my mask off, I'm still going to be wearing my mask. I like it. Teens are very self-conscious about their appearance a lot. This is the age, you know, when they get particularly self-conscious. So they've been really enjoying being able to cover their face if they need to. So I don't think that's going to be an issue with this age range. Maybe it'll be an issue with the younger ones, but I'm not even anticipating that at all.
And the last one we have is, can you say the vaccine is 100% safe even in the long term?
So they are doing ongoing studies, and they will be studying this vaccine for a very long time. So as far as, there's very few things in the world that are 100%, right? But there's also a lot of misinformation about this vaccine and what it is. So it's an RNA vaccine. And so when it's used, it enters a cell, and it tells, what RNA does is it tells the cell to make a protein, and it makes one of the spike proteins on that very ugly virus. And then the cell completely destroys the vaccine material. So biologically, it doesn't make sense that there would be any lingering effects from the vaccine. On the other hand, we have all read of many, many people having lingering effects from the illness. So really, I think if we have the option of preventing our children from getting this virus from the vaccine, that's much closer to the 100% safety than we can ever hope from without the vaccine.
You are so right about that. I think a lot of parents, especially of daughters, I've heard conversations about, you know, what if there are long-term issues with her being able to have fertility issues or be able to have children later on in life. And, you know, I think that's part of the misinformation that's out there, right? Like what do you say to moms like that?
So I think to reassure them that this is an RNA vaccine, it does not interact with the DNA and the nucleus of the cell at all. And it does not stay in the body long-term at all. And in fact, the vaccine is now being given to pregnant women because we know pregnancy is really high risk time to catch the COVID virus. It's dangerous for pregnant women, and it's dangerous for unborn babies. And so they're vaccinating pregnant women and recommending that. So there's no biological plausibility for any kind of effect on fertility or long-term effects from the vaccine.
I think that's such an important message to reiterate out there, because that's part of the misinformation that disseminates across all of media and social media. That's part of why this conversation is so important to us to have, to be able to provide the right kinds of truthful information, evidence-based information for what we know about this vaccine thus far, that, the benefits far outweigh the long-term damage that the virus can do on any person, but especially a child, right? Especially a child. Certainly. Well, we really, just to kind of recap, we talked a lot about just safety and efficacy of this vaccine, the Pfizer vaccine for the 12 to 15-year-old group. I think we are excited to be offering it. Certainly, we're in a great position now because vaccines are definitely more widely available than they were early on. And so this makes it plausible for our parents to find multiple outlets if it's not from your pediatrician, if it's not from a hospital, from other places that you can get your child vaccinated. And so we're really excited to start the process now, certainly to help get kids fully vaccinated before back to school comes in the fall. I think that's what is on all of our minds. I'm a parent. I have that in forefront of my brain all the time. And so we thought it was really important to be able to use our experts to help parents just take a deep breath and feel like they're making the best decision based on their child's individual needs and situations. What about, Dr. Houston, what about parents that have kiddos that have chronic conditions or maybe are at higher risk? Is it still safe for those kiddos to be vaccinated as well?
Yes. In fact, when the vaccine first rolled out, we were targeting actually adults with chronic medical problems. So we know that COVID infection can be dangerous to everyone, but particularly people with chronic medical conditions have definitely suffered a higher burden from this virus. So this vaccine is safe. It is not a live vaccine, so it's not any risk to someone who's has a poor immune system. Now, what they do say though is if the patient has a weakened immune system, it's certainly safe to get that vaccine. They're just not sure if it's going to work as well as it would in someone with a normal immune system. But we're absolutely recommending it for every single patient. There's no contraindication unless you've had basically an allergic reaction to the vaccine.
If your child had COVID, is it still safe to get the vaccine even after contracting the virus?
Yes, absolutely. And in fact, unfortunately, there are people who have had the COVID infection more than one time. So it's absolutely recommended if you've had COVID infection as well. And the other concern, of course, is I know that it's been widely published about the variants, the COVID variants. And so even if you've had COVID infection once, you're not necessarily immune from some of these other variants. So it's really important to get the vaccine.
So true. And I think it'll be important to watch the guidance too as it comes out for if this is a vaccine that our kids will get every year. And it'll just become like a flu vaccine where we add it to the list of annualized vaccines that we all need to get every year, even as adults. So I think that's really important.
I had a question. Sorry, this is Heather. I was wondering with COVID-19, I guess it's the antibodies that you get in your immune system from having the virus. What shows up in your blood from the actual vaccine versus having the virus itself? Do you have a certain titer of immunity that shows up after the mRNA shot, or is it just that your body's now trained to prevent that spike and it doesn't really show up as a number? I'm just thinking like other vaccinations, you have to have a certain titer in your bloodstream of the I'm thinking like the mumps, measles, and rubella or whatever. Is there a way to check what you have in your bloodstream? I'm just thinking, like, when you were saying the children that it may not take as well, the vaccine, how would you know, how much is your body able to fight against the virus after having the vaccine?
So, wow, that's a great question. So currently only the Pfizer vaccine is approved for under 18, but there's many different COVID vaccines that are being used. And each of those vaccines targets one particular part of the virus. So the Pfizer vaccine targets the spike protein, and you make antibodies to the spike protein. When you have actual COVID infection, your body typically is going to make multiple different types of antibodies. And so you may have more variety of antibodies, but also it appears that the level of antibodies in your blood drops off pretty quickly. The studies of the antibody titers, those have been done for marketing and science, but in real life, we're not drawing antibody titers at this time at all. And so there's going to be a certain bit of unknown. How immune is each person going to be to that vaccine and to the different variants that might be circulating? And some of the vaccines have done better against the variants than others. The Pfizer has done quite well. And so I feel good about recommending that particular vaccine.
Thank you.
It's a great question from a very informed mom. You get a gold Heather.
No problem.
Well, if we don't have any other questions, any final thoughts from each of you, Dr. Mikalsen, Dr. Houston, that you would offer to comfort and to add just to the conversation that we're having with our parents? Now's your chance.
I just want to add, I know some parents have expressed concerns that their kiddos may be afraid of vaccination because they're generally afraid of needles. And I've talked to quite a few kids, and I'm not getting that. Kids in that age range often ask for piercings. So they stop being afraid of needles at that point. But if you do have a concern, just talk to your pediatrician, see what they can do to help. Ask your kiddo, or think about how your kiddo has handled other vaccines, because by age 12, they have had many, many different vaccines. But I'm sure it's a conversation you can have with your pediatrician about how to make that part easier for them. But generally, kids who have had the vaccine at 16 and up say it's not a painful vaccine at all. They hardly felt it.
And at the Children's Hospital, the COVID vaccine team has been working out of our clinic. And so we have had hundreds of teenagers receive the vaccine, have done extremely well, not had problems. So I think they should be reassured. It's really business as usual. It is just like the other vaccines.
I think one thing that's nice is that it's elevated conversation about vaccines in general. So while we're all focused on the COVID vaccine, it certainly does elevate a conversation about just the importance of vaccines across the board. And now kids are exposed to it, in a lot of different areas. And so I think it creates an opportunity for a conversation between families, but certainly an enhanced conversation with your trusted, physician team that you work with for your child. So I think that to me is the most exciting part, is that we're talking about it and we're having this conversation. So I think this has been really helpful. There's Heather.
Sorry, I didn't realize my video was off.
That's okay.
Hot mess today. I did have one more question on just timeline, I guess. We're under the emergency vaccination right now. Just as far as research studies go, and what is the timeline when the Pfizer vaccine becomes incorporated, and you may have already, I apologize if you've already gone over that, when it's been incorporated into a normal vaccine usage, when it gets approved, is that usually a period of years or months, or how does that usually go about?
So that is a great question. And this is the fastest I've seen vaccines being rolled out. It's
Right.
an exhausting procedure over a number of years. So it will probably be several years before has official FDA approval. But the nice thing is we will have millions, if not, millions of doses worth of experience by that time. So we'll feel very confident in this vaccine.
And data too, right? Because they're collecting
Oh, absolutely.
all of the side effects, or any of the potential side effects that kiddos or adults are feeling. I think the CDC has done a really great job of trying to assimilate and accumulate that data along the way, which I think is again different from anything that we've ever experienced in our lifetime. So that's why it's so exciting to see and really interesting to watch.
Mm-hmm.
All right. Well, everybody, thank you so much for your time today. I'm so grateful to our team, to our VIP mom, Heather. We're super excited to have you here. I think, thank you so much for the conversation. Thank you so much for the expertise and for providing just evidence-based fact information for this conversation around the COVID vaccine, the Pfizer COVID vaccine for kiddos ages 12 to 15. Thank you guys very much. I hope you have a great day and we appreciate your time. Talk to you soon.
Thank you for inviting me. Thank you so much.
Absolutely. Thank you.
Thank you.
Thank you.